Three, two, one.
Hi everyone, good morning. So we are back with Beauty and the Business with me. Okay, so now we are at an actual beauty place. Okay, memang confirm about beauty, and we are at Vogue Clinic with Dr. Teo.
Hello, everyone.
Alright, so we are going to get to know Dr. Teo a bit, and then about Vogue Clinic, and then all the in betweens, all that stuff. Okay. Alright, so Dr. Teo,
Hi.
before we start, how are you? How's your day?
I'm good. How about you?
Tiring.
Tired.
Yes, I had a conference yesterday, so it was
So
a bit
busy.
tiring. Yes,
Yeah.
yes. Do you have any more patients today?
Yeah, I do have.
You do.
Yeah, but I restricted slot especially for you.
So sweet. Okay,
Thank you so
so
much for coming.
you're welcome. So we're not gonna take so much of his time. Let's get started with the first question. So Dr. Teo,
Yeah.
you started exploring aesthetic medicine pretty early.
Mm-hmm.
How early is that? Like how young were you when you started?
Oh my.
How young was him?
Okay, so I started on aesthetic medicine as soon as I finished my government service.
Oh, okay.
Yeah, and even within the periods of my service to government, I've already attended a few of the aesthetic conferences.
Mm-hmm.
And our Malaysia, that time and even present, the
Mm-hmm.
most famous program is called Malaysian Aesthetic Certification Program.
Okay.
So it was actually one of the first that comes up in the market.
Mm-hmm.
So immediately I enrolled myself into it.
Uh-uh.
I have already built up this interest even before I go into universities.
Oh.
Actually, the the story started to be a bit tragic actually. So
Why?
yeah,
Okay.
it happens during my high school time, and
Uh-huh.
I was actually riding my bicycles, and
Uh-huh.
somehow for some reason I just tripped over, and then I fell on my face,
Oh
and
no.
then it was quite a horrible sight for myself.
Okay.
Immediately, I was rushed to hospital. I was attended to with by a plastic surgeon, one renowned one in Penang. I'm from Penang,
Okay.
so it's from Penang Adventist Hospital.
Uh-huh.
It's Dr. O. So Dr. O actually attended to me. I lost a big chunk of skin on my face actually around this area. If you look closely, but don't look closely.
Don't zoom, don't zoom, don't zoom. Okay, okay.
So yeah, by that time, somehow Dr. O managed to help me to do a skin flap. Actually, we do manage to bring it and then cover up the injury. So
Oh.
during that time, I just amazed by what plastic surgery can do to a
Uh-huh.
person, because we are living in a world where we are being judged all the time, and a lot of social stigmas. If we have problems with how we look like, sometimes people will give you a special eyesight that
Yeah.
might be a bit not so comfortable.
Uh-huh.
So I start studying into the what is plastic surgery, what
Uh-uh.
is aesthetic medicine,
Uh-uh.
and then it strikes me that I'm interested in this field of studies.
I
So yeah,
see.
even so then I just continue on, and I finished my medical
Medical.
degree.
Mm-hmm.
And then while I was working the government, because we have to have a
The
compulsory,
husbandship, right?
yes,
Okay.
husbandship
Okay.
and medical officership,
Mm-mm. And more.
where we have to complete the compulsory service to the
Uh-huh.
government. During that time, I already having this path being
Mm-hmm.
put on for me, a voice that telling me I have to go into this. So immediately I see that aesthetic programs being offered in Malaysia. Immediately I get enrolled myself in.
Uh-huh.
So I've gone through all the trainings during my service in government, and then
Okay.
when I completed, because aesthetic medicines basically we don't have actually an actual direct path if we were working in government hospital, because this
Yep.
one is the service of duties and
Mm-mm.
treatments where we have some enhancements on our
Mm-mm.
appearance. So I have to resign, and I venture into the private sector,
Mm-mm.
aesthetic medicine.
Okay.
So yeah, just now asked me about inspiration, what sparks me
Yep.
into aesthetic
Yep.
medicine.
Yep.
It's actually a tragic story. It's a sad story, but it landed me here. Yeah,
But
so
he's here now. You're here
yeah, I'm
now.
happy
Yeah.
what I'm
Yeah.
doing now.
Okay. Okay. So it's actually like you actually went into medicine because of the accident in a
Yes,
way,
in a
and
way.
you want to go into the aesthetic. That's why you went to medicine as well. Is it
Correct, correct.
correct? Okay.
Initially, I was trying to get the path of plastic surgery, but the
Ah.
time frame and timeline is way too long for me.
Okay. 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 Got
So,
it.
and then there comes aesthetic medicine, where we have a slightly shortcut way to go into that, and we have a proper program to go through. Then I immediately, yeah, I just take up that opportunity.
I see.
Yeah.
Okay. Okay. So how long have you been running Vogue Clinic?
Okay, running Vogue Clinic, I think roughly around 7 years.
7 years?
Almost 7
Oh.
years. I was previously employed under another aesthetic clinics for
Mm-hmm.
2 years for training purposes,
Mm-hmm.
and after completion of the contracts, I came out and I established this brand,
Mm-hmm.
Vogue Clinics, and slowly I tried to expand and learning new skills and getting more and more what do you call that? The word of mouth
Yep,
from
yep.
my clients, and that's
Recommendation and all that.
recommendations. The
Mm-mm.
feedbacks from clients are very important. So our behavior, our techniques, our skills has to be up to par
Yep.
for better services to all our clients.
Mm-hmm.
Yeah.
Understand.
So
Right.
it's around 7 years. Yeah.
7 years. Wait, how young are you now,
Don't
actually?
calculate from there.
Because when you said you already run Vogue Clinic for 7 years, and I'm pretty sure like having to become studying medicine, HOMO, and then you did your training for 2 years. That's a long period. So I just want to know how
I
young are
take a
you?
guess.
38?
Yeah, almost there.
Almost there.
37. Yeah,
Okay,
yeah,
close,
yeah,
close,
close.
close, close. Good.
She's a very good calculator.
Because you have to calculate the medicine. Okay. All right, very interesting. So some people, because I've heard people go into aesthetic because they just want to be pretty, but yours are coming actually from a very sad story.
Yeah,
Yeah, from your childhood,
yeah,
very deep rooted.
yes,
Very interesting.
yes.
Okay, so from what I've understood, is it true that you are also not a big fan of like invasive treatments, like
Knife.
under the knife?
Yeah,
Are you okay with that? Are you not?
yeah. Actually, I'm okay with that.
You're
There's
actually
no
okay
issue
with it.
about that.
You're not issue with it.
Yeah, I'm
Okay.
a big supporter of plastic surgery
Okay.
because some of the procedures that what there is a limit where we can reach using just aesthetic medicine per se,
Mm-hmm.
because as we age, our body slowly a bit inability to catch up with the aging process,
Mm-hmm.
because as we grow, usually our bone will get smaller. If
Yep.
you look at your own parents, you will notice some of the changes that might have gone through,
Mm-hmm.
because as we reach the age of like 14 and above,
Mm-hmm.
some signs of aging will set in. The collagen will start to lose out, fat
Mm-hmm.
volume tends to reduce, and
Understand?
then the bone will get a bit resorbed, will get a bit shrunken.
Mm-hmm.
So that's the point where aesthetic medicine we cannot catch up anymore. So I need to refer out. So we always
Ah,
have a preferred hospitals to be referred to.
I see.
Um, when we reach to that stage where we cannot offer anymore, I have to let
You have
them.
to refer
Yes,
outside. I
correct.
see. Okay.
So in terms of aesthetic medicine, we mainly we master in procedures that are either non-invasive or minimally invasive.
Oh, okay.
Yeah. So minimally invasive means procedure that might involve needles, a little
Mm-mm.
bit of short downtime procedure, not
Mm-mm.
as aggressive as what surgery is doing.
Mm-hmm.
So minimal invasive is something I do day in, day out,
Okay.
like lasers, injectables,
Mm-hmm.
thread lifting. All these procedures are
So those are
um,
minimal invasive.
yeah, minimally invasive.
I see.
So
Okay.
this kind of procedure, it doesn't give you that much of downtime. There is
Mm-hmm.
downtime, but very, very subtle. So
Mm-mm.
it can be a little bit of swelling, a little bit of redness, which is
Mm-hmm.
easy tolerable. So most of our clients, after the procedure, they immediately go back to their work.
Mm-hmm.
They can go back with their workout. So this is something that is eye-opening and inspiring to the clients,
Mm-hmm.
because it doesn't give that much of issues compared with the traditional therapies like
Yep.
cosmetic surgeries. So cosmetic surgeries, for example, things like skin grafting or facelifting, of course, we have to might want to stay out from the social eyes for might be like a week or two for
The recovery.
recuperation. Yeah. So Vogue Clinic, basically we are focusing a little bit more in terms of minimally invasive procedures.
Mm-hmm.
So you can look good and you see the progressions of the results over
Mm-hmm.
time,
Mm-hmm.
and then clients basically a bit more appreciative of that kind of therapy.
I see.
Yeah,
Okay. So, Vogue clinics specifically focus for the non-invasive to minimal invasive
correct.
treatments.
Yeah,
Yep. And you mentioned, of course, with age, you would require the outside treatment, right? Because
correct.
aesthetic medicine cannot hit. So, do you recommend for the younger generation, the younger people, if they want to take care of their beauty, take care of their skin, take care of their appearance, they should start now. Does that help with like not needing to go under the invasive part?
Correct. So
Okay.
this is a big statement from her, which is
Asking.
very truthful and
Okay.
correct to do. Yeah. So actually, it's best we start early because
Okay.
there are multiple research papers or literatures
Mm-hmm.
already looking into this possibility.
Mm-hmm.
If we start early, really go into a positive side, or if we go into the
Negative side.
backfiring
Yep.
side.
Yep.
So if we do correctly, correct skills, correct products,
Mm-mm.
basically we preserve how we
Ah.
look like. So we do have clients as early as 18 years old,
Oh.
even have like 14 years old with the consent of
The
parents.
parents come as well.
Yeah,
Okay.
yeah. If we are doing the minors, we
Mm-hmm.
have to go through with the guardians of
Yep.
parents. So the procedures are basically safe, depending what kind of procedures we are looking
Mm-mm.
into, because each clients they have different requirement, they have different expectation.
Yep.
So we have to customize the treatment based on what they need.
Mm-mm.
So if we're starting at a younger age, especially treatments like you heard a lot like Botox,
Yeah.
filler.
Yes.
Yeah.
Yes. I've heard a lot.
So yeah, Botox, a lot of people will cringe a little bit, but actually, if a proper education, actually Botox is something very safe to be on,
Okay.
and so many research papers, so many evidence-based medicines literatures has been there,
Mm-hmm.
because if you start early, actually it kinds of what do you call it? You'll recondition the skin, and you'll stop the
Ah.
wrinkle from formations,
Mm-hmm.
and you'll preserve how our appearance is. Starting from year 20 to 40, basically we look almost the same if we manage to maintain the treatments along the
Mm-mm.
way.
Mm-mm.
So, of course, the negative sides of aesthetic medicine is overdoing, so overfill syndrome. So things that I don't really like, and
Mm-mm.
I have to really counsel my clients.
Mm-mm.
Some clients they might have some psychological demands like
Okay.
body dysmorphic disorder. People
Understand.
who have wrong perceptions
Perception.
of
Mm-mm.
how they look, how they
Mm-mm.
appear to be. So we have
Mm-mm.
to have our ethics to properly counsel them,
Mm-mm.
because estate medicine is no longer related money and how much revenue that we may gain.
Yep.
We have to look into the well-being of the person.
Yes.
Yeah,
Correct.
because it's a long-term clients, we have to make correct decisions, the
Mm-hmm.
proper decisions to our clients,
Mm-mm.
so that they will continue to follow with us, and then
Mm.
they're continuously looking good and preserve their appearance.
Mm-mm.
So I'm not sure with other settings, but this is basically my goal
Your goal. Okay.
yeah, in the age preservation.
Age preservation. I
Yeah,
see. So preferably, if you want to maintain how you look, start early. Doesn't matter
if
what age,
possible.
if
Yeah,
possible. If you
yeah.
have the budget, if you can. I
Mm,
see.
yes.
So if someone doesn't start early for whatever reason, right, it
Mm-hmm.
might actually cost more to maintain beauty or
Mm-hmm.
get that again later on in life, right? It
Yes,
might be more
it
costly.
might be. It
Might
might
be
be.
more
Yeah,
costly. Okay.
yeah.
Understand? So at Vogue Clinic and you, at Teo, you care about beauty, like how we look like, right?
Mm-hmm.
So how do you think maintaining one's outer beauty helps with one inner beauty?
Okay, this is a very good. It's a very good statement and
Mm-hmm.
good questions.
Mm-hmm.
Yeah, basically, that's a very close relationship.
Mm-mm.
So feeling good is actually closely related to how we look like from the outer appearance, because actually there's so many research being done on this
Mm.
topic per se by itself.
Okay.
So even if I'm not mistaken, there's a research paper made in 2009.
Oh.
They're researching a group of people.
Mm-hmm.
So a group of people wearing a shirt with
Okay.
a S Superman
Oh,
logo.
okay, yeah,
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 a
okay,
Superman
yeah.
logo.
Uh-huh.
So Superman sometimes is a sign of empowerment.
Yes.
Yeah, some strength.
Mm-mm.
So from that research, they found out the people who are wearing the Superman clothes, they
Mm-hmm.
have appeared to be more confident compared with a group of people who are wearing just plain T-shirt or
Mm-mm.
white T-shirt. So the deductions from the research says that actually the outer appearance does impact has a big impact on the mental health of the persons.
Mm-mm. Mm-mm.
So same thing with aesthetic medicine. If we appears to look good, it affects us.
Yep.
So it gives us more confidence,
Mm-mm.
more self-esteem,
Mm-mm.
and of course, we have better presentations of
Yes.
ourselves,
Yep.
and we are living in a world quote unquote very realistic world.
Yes.
People start judging you. My work especially, I'm being judged by my clients day in, day out. My staff also judge me. The cleaner
Everyone
outside
judging
also
you.
judge me. The restaurateur judge me.
Okay.
Yeah, we are living in a world where appearance says
It's
a lot of
matter. It's
things.
matter.
Yeah, it does matter. It's a
Mm.
quiet statement that actually appears does matter.
Yes, it's
And if you
true.
look into a corporate company, you
Mm-mm.
might tend to see this presentation macam tersirat lah.
Yep,
There's
yep,
something that is inner, that's not unspoken truth.
but it's
People who,
there.
yes,
Yeah,
the people who look good will easily climb up the corporate ladders. They
I
get
agree.
better opportunity in their jobs.
Mm-mm.
Like yourself, you look so good. So easy for you to become MC
Okay.
over so many people. So yeah, so with having have this kind of mentality, it does help to improve, it boost personal
Personal confidence, yes.
myself is a true example. I don't look good, but
You
because
look
of Dr.
good.
Danny, because of the plastic surgeon who
Okay.
corrected my face,
Mm-mm.
I managed to come out to meet people. If I were to live with the big scar on my face, then there will be a big trouble for me.
It will have affected your self confidence, your
Yes,
growth as well, right?
yes, yes,
I
yes.
see. Okay, yeah, that's true. Cause like some people, I, I'm not gonna say you. I personally believe like there's this movement of like self love, right? Like love
Correct,
yourself.
correct,
But I'm pretty sure you also want to present yourself nicely, right? So there's nothing wrong with making yourself better,
correct.
making yourself look better.
Yeah, in the Korean culture, actually
Mm-mm.
looking good is a sign of respect to
Oh,
other people.
really?
Yes, do you
Oh.
realize all Korean people before they get out from the house, they actually make up before
Yeah,
they have to step out from
they
the house.
always look so beautiful.
Yeah, it's a sign of respect in their own culture.
I see.
I hope Malaysia also. I think Malaysia is moving to that direction.
I mean, it is nice. I
Yeah.
mean, when we see pretty people or people who look good, we like to see that as well, right?
Correct.
Compared to someone who looks, I mean, we don't know what they're going on, but like someone compared that they don't look as clean, as clean cut, it's not as nice to the eye. I
Yes.
personally say that, not him. I. Okay. Okay, all right. But I personally come from a background that was not introduced to aesthetic. Actually, when I hear the word aesthetic when I was younger,
Mm-hmm.
it comes with like people who are arrogant, people who will look weird because that was the perception I grew up with. So, Dr. Teo, like within the industry that you've been in for like I think 10, almost 10 years, right? Because you had
Yes,
2 years
yes, yes.
training and all
Correct,
this.
correct.
What is the biggest misconception that you think there is for aesthetic medicine?
Yeah, so this is very relatable to my day in day out job. The biggest misconception is actually the perceptions of the community that aesthetic medicine is actually altering how we look like. It's actually not equivalent with plastic surgery. It's not to say that plastic surgery is doing too much alteration. Basically, all our goal is actually to make us to be a better person, preserve how we look like, not overdoing it. But somehow there are several negative. Some groups of people they might have gone to the wrong route. It
Yeah.
can be because of the disorders, psychological disorders. They might have overdone things like it's very real in the community, is overfill syndrome,
Oh,
or
okay.
people have gone through the wrong kind of treatments, the wrong types of products being injected into the skin that cause lifelong scarring to the face. So yeah, in Malaysia especially, relationship between aesthetic medicine and plastic surgery is sometimes very real, especially our country is quite religious.
Yes.
Some of the religion might have perceived this something that's not correct to be done, because some religion thinks that we have to be satisfied or self-contented with what our God has given us, our
Yep.
parents have given us. But actually, aesthetic medicine is not plastic surgery.
Yep.
We doesn't really
Alter
too much,
anything.
not
Yep.
alter too much. And things that the products that we put in, it is actually being absorbed under our skin over the years. And then if not, it convert into something better like collagen, and it looks younger. The skin gets more elastic, and Of course, aesthetic medicine, things like a bit more towards reparative, like acne, scarring.
Yes,
That one
yes.
not much of an issue. Just that it might have carry a conception that is actually relatable to plastic surgery, that is life altering,
Mm-mm.
but it's not that. So we hope the population will get, the general population or
Mm-mm.
community will understand the distinctions,
Difference
the
as well.
difference between aesthetic medicine and
And
plastic
plastic
surgery.
surgery, yeah. I think
Yeah,
people always group it together. So then it's just, oh, plastic surgery, aesthetic, you're all the same.
yeah,
That's the wrong
yeah. That's
mindset.
the conception.
Mm.
Yeah, but plastic surgery, if you are under good hands, skillful hand, they don't alter that much. It
Mm.
basically it give you back the confidence level,
Mm-mm.
and then it preserve how you look like. Yeah.
Yep,
So
understand.
this is actually the goal of being a doctor in this field of beauty industry.
Yes,
Yeah,
understand.
yeah.
Thank you, Dr. Teo, for
Thank you.
clarifying on that misconception. So I hope people understand that those two are not the same thing, and you need to also know what product that you're using. Consult
Correct.
with your doctor and all that, right?
Correct. Correct.
Okay. So there are people who has never tried aesthetic treatment at all before. I actually never tried until 2 3 years ago. I started with Pico,
Mm-hmm.
and then I think early this year I tried chemical peel.
Mm-hmm.
So I was actually very scared because
Mm-hmm.
I see all the stories online and whatever, right? But when I tried it with the doctor that I went to, the clinic I went to, it wasn't so bad.
Yeah.
It was actually quite okay.
Mm-hmm.
So for you, Dr. Teo, what or how do you and Vogue Clinic help first timers to be more comfortable doing it?
Okay. So myself,
Mm?
because I do understand the mentality of the clients. First comer,
Yeah,
I
yes.
always put myself in their shoe. I always
Mm-hmm.
put myself in their perspective.
Mm-hmm.
I don't go too hardcore on the first sessions. So
Okay.
pico laser, chemical peels are among the first few things I'm going to introduce.
Okay.
Usually I look into their their complaints, because
Mm-hmm.
every client, they come with their group of concern, things
Yes.
that they want to get themselves improved on.
Yes.
So a lot of times, first timer who are, I have to visually gauge how far she can go
Mm-hmm.
in terms of the fear level,
Yes, yes.
anxiety. So if people who are coming a bit anxious, then I
Mm-hmm.
have to go very light and very slow to
Mm-mm.
them. So the treatments that I'm going to instigate also will be a bit more comfortable.
Mm-hmm.
Even our clinic, we have facial therapy,
Mm-hmm.
so we can start off from there.
Okay.
So if once they see the changes,
Mm-hmm.
the appearance changes, they slowly get a better conception, a
Mm-hmm.
better perceive into the aesthetic medicine,
Mm-hmm.
and then they'll slowly open up themselves to a bit wider kind
Mm-hmm.
of treatment that was going to plan to them.
Mm-hmm.
So of course, I go step by step. Yeah.
Yep.
Importantly, in our field, we have to have a very good rapport with our clients.
Mm-hmm.
No matter what class you're from, what background you're from, we have to treat equally as
Yes.
normal doctors. This is
Yes.
actually our oath, being a doctor.
Mm-hmm.
So when they come in,
Mm-hmm.
again, visually I have to assess how is their fear level. So I
Mm-hmm.
start something light and simple,
Mm-hmm.
and then I start introducing bit by bit,
Mm-mm-mm.
according to their needs, of course.
Yes, of
So
course.
once they build their own confidence and more receptive, then
Mm-hmm.
we start something a little bit more, maybe minimally invasive procedure,
Mm-hmm.
like microneedling or filler injection,
Mm-mm.
Botox, threads like that,
Mm-mm.
and then slowly move on to slightly more high-end procedures.
Mm-mm.
So yeah, so it's very good for you to start off with the chemical peel and pico
Yes.
laser.
It
Then we
was
can,
it was very
yeah,
interesting sensation to
yeah,
experience.
and then the result is quite noticeable. Yeah, if we
Yes.
do correctly with the
Yep.
correct settings and stuff.
Yep.
Yeah.
I actually like my skin now has a slightly breakup is because I've been busy with other stuff. So I was planning to go back to aesthetic clinic to
Uh-huh.
get treatment again.
Mhm.
Yeah.
You're here.
After this, not now. Not now.
The form will be sent to you.
Okay. All right. So that is how you help first timers to adjust, to adapt to
Correct.
getting treatment. Because even pain tolerance, everyone has different pain
Very
tolerance. Yeah. Because like I've tried chemical peel, it stinked,
Mhm.
but it wasn't so bad.
Mhm.
Because I've heard of people who feel like their face was burning,
Yeah.
and maybe their pain tolerance is lower.
Yeah.
So that's why they're not used to it.
Also the products, the solutions that we use.
Oh,
Yeah, we have to really control
Mhm.
according to skin type. Yeah,
I see. Okay.
Yeah.
So your skin type also affects the
it plays a big role.
okay,
Yeah.
understand. Okay. So Dr. Teo, now we're in like I don't know how 7th of November.
Uh-huh.
All right, so we're almost towards the end of 2024. So as a doctor yourself, what do you think has been the most popular treatment of 2024? What do you think?
There's a lot.
There's a lot, okay, but what is the one that you think like just stood out 2024? Like a lot of people asked for it.
A lot of people asking for it. Basically, my day in day out works will be involving fillers.
Oh, okay.
Lasers.
Fillers, lasers.
Very hard for me to handpick which one that is the most favorite because different clients, different requirement, different expectations. So we're going to design according to what they need. I think this year the most I do, of course, is filler therapy. Lasers, if you are like less invasive, will be done by our beauticians. They are trained
Okay.
beauticians and nurses. They can operate the machines. So that one among the highest demand that we are having.
Okay.
Yeah. So filler injection is something rooted in our industry for so many years because of the alteration. You can see instant
It's the effects on your
improvement.
skin, right?
Yes. So this one is something that they've been carrying on for a long time. So this year, I think, these two are among
Like
the
the
top two
Okay.
therapies in
Yep.
our clinic.
Because I've like in the Malay community, I've
Yeah.
seen like I wouldn't say all,
Mhm.
but I've seen some influencers who very much go and share that they do fillers. Fillers for their nose, fillers for their lips,
Yeah.
fillers for their jaw.
Yes.
So that's very interesting to see. What's the difference between fillers and Botox?
Okay, these two things are completely separate. Filler, being said that the words, it means volumizing. Fill it up, so it comes to the word filler. Botox is actually a toxin that actually relaxes the muscle so that we don't have that much expression where we inject it in. So the main indications using Botox is always this kind of lines, the stress lines.
Like, I have this.
Yeah,
It's like,
the stress line,
Yeah.
the profits, and
Yeah,
sometimes
yeah.
it gets in the way. And sometimes mispresentations of what their emotion is. Some people they tends to do this.
Yes,
You
yes.
still-
I
yeah,
feel judged.
yeah, it is okay for me,
Okay.
but to other society, as I mentioned, is a judgmental society.
Yes.
They might judge it wrongly. So
Yes.
they might be happy, but they have that expression. So a lot of times we have to resort to Botox therapy just to relax it. So to make them more blending into the community, to blend it easier.
Yep.
Yeah. So these are the main difference. So filler usually I use it to correct volume that's already reducing as we grow as early as 20 to 30 years old. We tend to lose out a lot of collagens, a lot of fat
Fats in the
volumes.
body, yep.
So that's why the first sign that we always look at is always the under eye. It loses out some volume, the face starts to sag. So our face tends to go into like squarish appearance.
Yep.
So to replace back, a lot of times I will look into derma filler because the result can be instantaneous, immediate, and then the client satisfaction is very high. So of course the skill techniques it plays a big role.
Yep.
So again, the two main difference filler, Botox filler is to fill up, Botox is to relax. Yeah, so it's a complete different thing.
It's actually for
altogether.
different reasons,
For
actually.
different
Yeah.
reason
But
altogether.
sometimes people might assume it's similar in
Yeah,
use.
yeah,
Yep. Understand?
yeah.
Okay. So another question I have: you hold an
LCP.
LCP, the letter of credentialing and privileging, or
Yeah,
something, right?
yeah,
Okay.
yeah.
So in aesthetic medicine specifically, can you tell me why is it important for a doctor who wants to go into aesthetic medicine to have this credential?
Okay, so this credential LCP is actually very important in Malaysia. It signifies or it defines credibility, trustworthiness, and of course evidence-based medicine.
Yep.
Yeah, the LCP aesthetic medicine is actually regulated under our Ministry of Health.
Oh, it is?
It's regulated
okay.
the government. So we have to go through a proper line of the educations provided by the government. Just now I mentioned MAC is one of it.
Yep.
Nowadays, there's mushroomings of other programs. They established by universities and colleges. So they equally will give a good path, a correct path for the doctors to attain the LCP license. So the LCP license, at the end of the day, we have to go through a proper examinations and also a viva where we are going to meet a lot of experts in the field. They'll need to interview and whether or not they want to pass us or not. So once we get the LCP, means we are eligible.
Certified, yeah.
Yes, we are certified to do procedures that within the scopes that's provided by our Ministry of Health. So why LCP is so important nowadays? Because there are too many ill practices.
Yes.
A lot of illegal practices. I'm not sure if you're aware or not.
I'm aware.
Yeah, in the market, basically run by non-professionals. It's a sad thing to see. It's a gray area. They have done this for so many years and it actually jeopardize our industry as well.
Correct.
So what they're doing there is actually they are using unknown products, things that they don't even know where the source is. And they practice or experimenting on the client's face.
Yep.
So it's actually not an ethical things to do. And our government realized there's a big issue in our community, and then hence the appearance of LCP aesthetic medicine.
Yep.
So we are trying hard to actually educate our general population in regards to LCP and why we need to avoid the people who doesn't have the LCP licensing because of the potential health
risks and everything
that will come with that. Because after they inject something that they are not known of, and they develop complications, and the clients go to doctors don't even know what they are going through.
Yes.
So there will be a lot of complication and a lot of backfiring in terms of treatment. So we have to like really try and error what is going on and then try to rectify what has been done. So some worst case scenario, the products they put in, they disfigure the person, and it's a lifelong scar, and it destroys a person's career, in the livelihood. So it's a sad thing to say, but we're trying our best to educate the population in terms of the importance of LCP licensing.
So people else, your doctor needs to have an LCP, right? Where you go niche, supposedly they should have it if you want to go for some aesthetic treatments. Because on TikTok, actually, I don't think it was in Malaysia, and I was surprised when I saw that video. A person was sharing, they saw news, I forgot which country, so not certified, I don't think that person was even a doctor. They use, dental, where they suck the water, like the saliva. Someone was using that equipment for liposuction.
Oh my goodness.
Yes.
That is revolutionary.
I was so surprised when I saw that video. I was like, that is so dangerous, right? That is not even the proper field that's dental equipment for this. I see. So actually knowledge and like sharing exposure is important for the community, right?
Correct.
Yep.
That's why I need to have this show.
Yes, because people need to understand. So I understand, like, have you heard of the fake dentists, like the ones that do in hotel rooms? Like they're not even dentists, but they just do it for a cheaper price. So some people, money can be an issue, pricing can be an issue.
Correct.
But there's a reason why doctors like you, clinics like Vogue Clinic, charge a certain price, right? Because you maintain a certain quality. So can you share a bit? I, as a customer myself, because like at first when I didn't do, I was like doubtful, like why cheaper prices actually is not good. Like very cheap sometimes, that doesn't make sense. Why is it not good actually?
Okay, you just mentioned about cheap price, but in fact, this kind of illegal practices, they charge higher than us.
Really?
Yes.
There is? Oh my god.
There is.
Oh, okay.
Yeah, it's not only cheaper price.
Okay.
Some they have the audacity to charge very exorbitant prices to the clients, and they're at their own risk. Yeah, so because our clinic settings, we have to have products that's actually certified.
Yes.
Products that is actually regulated.
Yep.
So this kind of products, it comes at a higher costing.
Of course.
So we have no choice. We have to follow the standard retail pricing, the clients, but of course the safety is guaranteed. So good thing about all these things is actually is the difference between the illegals and the legal settings, the aftercare, the responsibility of the injector, of the people who perform on your face. That is the one major differences. the skill, the beauty, the people who illegally practice,
Yep.
I do not deny that they might have certain skill set. They might
Mm-mm.
be doing a lot until they are very skillful.
Mm-hmm.
But in terms of handling of complication, there
Yes.
might come to it will be a shortcoming.
Yep.
So they might be wrongly manage the aftercare,
Mm-hmm.
might be wrongly manage the complication and give us
Yep.
even more problems to
Yep.
medical
Issues
attendees. Yes,
later.
yes,
Yes.
correct. So again, be careful. People who are going through all these procedures that is not certified or
Mm-hmm.
they go through like social media, it's a
Mm-mm.
very, very gray area. The
Correct.
government cannot do anything about it.
Yes.
Our community, we have struggled through many, many years about the same issue again and
Mm-mm.
again.
Mm-mm.
It doesn't seem to solve it because they do it in the background.
Yeah.
They are not regulated.
Yep.
They do in hotels somehow.
Mm-mm.
So I think the people awareness is very important, the community awareness. But I do see our general population in Malaysia, they are getting more and more wise in terms of
Mm-hmm.
choosing aesthetic medicine.
Yep.
Even my clients who come to me, they even educate me on the products they are going to use on them. Okay, all
Okay.
this is good.
Okay.
So I
Okay.
cut short on my consultation.
Okay.
So it's a good thing. It is
Yep.
a good
Yep.
thing. So
Mm-hmm.
we hope the general population to be a bit more aware about
Mm-mm.
the malpractices
Yep.
in the market, not only in
Mm-mm.
Malaysia, it's actually happening around the world.
Yes.
It's
Yes.
been there. This is actually growing for many years. We can't
Mm-mm.
really do much on it. We try to push our government to do some initiatives. They are trying their best. Yeah, they
Yep.
try to shut down a few premises
Yep. Yep.
that really causing problems to the people.
Mm-mm. Mm-mm.
Yeah. So yeah, I think
Yep.
I hope I answer your
You
question.
did. You did. Because I feel like it's more like the education as well is important. People need to understand and all that,
Correct,
right?
correct, correct.
Because you can't really blame proper doctors for someone that is not even a doctor that did their fault.
Yes,
Yep.
yes,
Yep.
yes,
Okay.
yes, yes.
So before we almost wrap up our conversation here, Dr. Teo, so we started, and you said you started this Vogue Clinic, being a doctor, becoming aesthetic, because of a tragic story, right?
Thanks for reminding me.
Sorry, I'm just sharing
Yeah, I
that.
get over it.
Yeah.
I already
Okay.
got
So, as a doctor now yourself,
Yeah,
specifically in aesthetic in
yeah,
Vogue Clinic,
yeah.
if you can share, of course, if you can share, is there a client that came back to you that you gave the same effect to that person? Like they might have really bad skin issue, whatever, and because of you, because of Vogue Clinic, maybe that it changed their life 360. Do you have any stories about that?
Honestly, there's a lot actually.
Oh,
Not to
okay.
boast myself, but it's actually a lot. Even this morning, I have clients who are quite
Oh.
appreciative of what I'm doing for her.
Mm-hmm.
It's their gratitude and their appreciation is really priceless to us.
Yep.
Even myself and my staff,
Mm-hmm.
they can feel the joy. It's
Yep.
actually very important to really look into their mentality as a clients
Mm-hmm.
during the consultations and all that, and
Mm-hmm.
then we customize treatments that is really, really solely for them.
Mm-hmm.
Yeah, a lot of practices they are a bit more money driven, so
Yep.
a lot of treatments they are being introduced sometimes shock me as well.
Oh.
That might not be related to their issues because of the money driven conscience.
Mm-hmm.
So nothing wrong, just that it's best if we can deliver what we are at hand. Of course, if treatments that's already a bit out of my hand, I definitely refer out, especially like plastic surgeon and
Yep.
dermatologist. Yeah, if it's manageable under my expertise, I'll try my best to provide to our clients. So yeah, so
You have a lot of stories actually. It's just like countless of stories. But that's a good thing actually. That means you have real life testimonies and like, word of mouth that shows that you do good practice here. You give great
I
results
hope
for that.
so. I hope so. I hope
I
so.
mean, hello, you just said there's a lot of stories. But okay, so that's good to know. So you guys just, I mean, like, where can they read those reviews? Like, is it in Google Maps? Is it on social media? Where
Yeah,
can they?
so you can actually log into our Instagram, Alliance Vogue Clinic KL, and we have TikTok, Alliance Vogue Clinic, and of course Google reviews. You can go through. So these are the real life feedback of our
From
clients,
people.
and sometimes they send in the feedbacks to our
You directly?
consultants, yeah, to our consultant because we do have follow ups for our clients. So the gratitude from there is really priceless. I've gone through, and this is how it propels us to work harder
Yep.
and try our best to provide the best. Of course, there are sometimes shortcomings. Of course, I have to look into what is going wrong.
Yep, of course.
Yeah, and then we have to have proper mutual understanding between both of us,
Mm-mm.
so that we can provide better results to our
Mm.
clients. And of course, we have to rectify, because humans,
Of course.
being human,
Yeah,
we make mistakes.
normal.
Yeah,
Yep.
but we need to have a good understanding, and then we have to look and rectify so
Yep.
that we don't repeat the same thing.
All right. Okay.
Yeah.
So thank you so much, Dr. Teo.
Thank
So
you so
let's
much.
before we end, because I'm pretty sure you have clients to go to. What's next for you and Vogue Clinic after this?
What's next for me?
Yes.
Okay, I see a big potential.
Mhm.
Moving forward,
Mhm.
would be the treatments of regenerative medicine,
Oh.
especially stem cell therapy.
Okay.
Yeah, so it's actually in the society for a long time, in the market for a very long time.
Mhm.
So it, I think it's something is going to grow
Mhm.
and groom. Yeah.
Okay.
So because our society is getting we have more and more people going into advanced age, and
Yes.
people are
Yes.
more capable nowadays,
Mhm.
because of the social economy.
Mhm.
And stem cell therapy is not something new. It has
Okay.
been there.
Okay.
Basically, we have a lot of labs in Malaysia, and it's
Mhm.
under regulations of by our government.
Okay.
Yeah, so it's just gaining popularity. It's just the issues is that the the possibility of attaining the stem cell therapy is a bit difficult at this point because
Mhm.
of the costing.
Okay.
Yeah, because to produce and regenerate that much of stem cell, we have a very great A laboratories,
Okay.
and with world-class scientists to produce that high-quality stem cell.
Mhm.
So if it's gaining more and more popularities and more generalized, I think the price will slowly come down to
Mhm.
be a bit more affordable pricing,
Mhm.
and more people will benefit from that, because stem cell
Yep.
therapy is something that it actually helps to repair.
Mhm.
As we age, some of our organs might go through some insults.
Yep. Yep.
People who are more into that, like people with diseases like
Mhm.
diabetes mellitus, they will
Yep.
benefit a lot for
Mhm.
stem cell therapy. And research already shown that the people who are going through the stem cell therapy, that actually they reduces the usage of insulins to a stage where they
Oh.
stop using insulins.
Okay.
So it's something very commendable, and
Mhm.
something we want to look into as well,
Okay.
and hope to explore more. Yeah.
Okay. Okay. Hopefully. Hopefully.
Yeah.
So maybe in 2025 we might see that.
Yeah,
Maybe.
maybe
Maybe.
December this year.
Oh,
Who
maybe,
knows?
maybe. Yeah, for
Yeah.
Christmas. For Christmas. Wanna
Yes.
look good for Christmas. Okay. So Dr. Tip, before we wrap up, do you want to share anything else to the audience? Maybe to first time customers or anyone who wants to try anything at Vogue Clinic?
Okay, so if you're interested in aesthetic medicines, I always can reach us via
Mm-hmm.
our social media,
Mm-hmm.
as I mentioned just now.
Mm-hmm.
I think it'll be under the captions as well.
Later we'll share, yes,
Yeah,
of course.
yeah, you can get in touch with us if you
Mhm.
want to know further. Feel free to visit us. I try to get you more detailed explanation.
Uh-uh.
Of course, I need to look into what is your main concern and stuff like
Yes,
that.
of
And
course.
SMS is getting more and more common nowadays,
Mm-hmm.
and you can easily access to the internet websites to look into what are being offered. But if
Yep.
you want a bit more customizable to your
Needs.
kind
Yep.
needs,
Yeah.
yeah, feel free to come to me.
Yep. Consultation. Why not?
Yeah, I have
Okay.
another two more doctors, very established doctors,
Okay.
Dr. Justin and Dr. Kyra. They are very professional, so they are going to provide you a very good insight into what aesthetic medicine is all about.
Okay.
Yeah, so feel free to come to us.
All right. Okay, so that is all from me and Dr. Teo. Thank you so much for your time
Thank
today.
you so
So
much.
everyone, if you want a consultation, just hit them up on IG. And that is all from Beauty and the Business. See you guys. Bye.